Welcome back to The New Health. We have with us Dr. Cheng Ruan from the Texas Center for Lifestyle Medicine. Welcome, Dr. Ruan.
Hey, thanks a lot. Thanks a lot for having me here.
So happy that you're here.
Yeah.
So Dr. Ruan is the CEO for the Texas Center for Lifestyle Medicine, and I would love to hear a little bit about what you're working on and what your purpose and mission are right now.
God, I'm so glad you asked. Thank you very much. So, Texas Center for Lifestyle Medicine was founded in 2017 as a bit of a dream. And the dream was to see if we can offer the absolute best style of medicine that almost seems like it's concierge, but it's not, within medical insurance settings, Medicare, and stuff like that. So, fast forward to now it's 2024. Not only have we done that, but I do think we've surpassed in our outcomes and metrics in a lot of chronic disease states, and especially the more complex ones as well. And so it's really fun to see my team and how we engage with patients and also hear the patient stories and share the patient stories, which we do often on social media, so that we can sort of create this unity and this bond in medicine, which I do think is missing. But I'm super proud of my team.
Oh, that's so wonderful. I love hearing all of that. And you're insurance-based, actually.
Correct, yes.
That's really incredible in this whole world where things are changing a little bit into that lifestyle medicine space, where a lot of it is not insurance-based.
Actually, believe it or not, most of it is still insurance-based, but not many people can make it so that it stays for a long time. It's sort of the unfortunate situation. There is a business to medicine there. So I think the way that we all have to look at it as a community is that there's good medicine to be practiced, but then we have to redefine what medicine really is, the new medicine, if you will, right? And how it looks forward into the future. Because we're kind of in this world of there's internet, and then there is artificial intelligence, and we're in this world of hyper information right now, right?
Yeah.
And so what happens is that people are thirsty for information, but information can come from any source. So I do think the value of what we do should be educational and looking at the community, and that's what makes us super special.
Dr. Ruan, how did you get in this in the first place? How did you come from, I know you went traditional MD training, and how did you get on this path?
Yeah, well, it's still originally MD's training.
Yeah.
I think that whenever you hear sort of my early life, you kind of understand where this all came from. So my mother is an acupuncturist, Eastern medicine, Chinese medicine doctor. And then my father's side of the family has also Eastern medicine, but my father is an MD PhD in research. He's the Dean of Pharmacoinformatics, University of Houston Pharmacy School. He's at Baylor College of Medicine. Has the most number of American Heart Association medals, et cetera, et cetera. So we sort of have this East meets West approach. But for me, it was all one thing to really begin with. So even going through medical school, my job in medical school is to identify what's wrong, what's wrong with the system. So I think from a systems point of view. And a lot of what I do is trying to engineer a system that actually works with the current systems so we can all immediately benefit. So that comes from this principle called inclusionary principle. We have to include everybody. So right now medicine is a bit disjointed. You have this type of medicine, you have lifestyle medicine, functional medicine, et cetera, et cetera. And then that can create sort of this air of conflict and exclude, and we don't necessarily want to do that because unity is what really brings us together. And so my dream is to not label the medicine eventually, not label the medicine. Good medicine really should be practiced, but including people in the conversation, also learning from our patients. My favorite thing really is learning from our patients. And that's why we developed such a close-knit relationship with the Texas community.
That's really incredible. So this inclusionary, so when we talk about inclusionary, I know you and I've spoken a little bit. I would love to share with the audience, and I know you briefly spoke on it. How can we help people in that inclusionary space? It's medical providers, it's patients, it's both?
That's a tough one. So it's medical providers, it is patients, it's their family members, it's also the insurance companies, it's the hospital systems, it's the social workers, it's the psychiatrists, it's everything, right? And so right now, I think the problem originally started when we tried to categorize medicine and different diseases with these disease codes, if you will, ICD, International Classification Diseases. So what happens is that governments across the world were trying to get data for population health, meaning that they want to know who's sick, when, at what time, who's more likely to be hospitalized. But what happens then is that you start making programs for this population and this population, and we kind of lose sight of the bigger picture of what's going on. You can have like a chemotherapy for cancer, or you can have high blood pressure medicines, and then you have diabetes medicines, et cetera, et cetera. But then you have different bodies, regulatory bodies overseeing these things. But when you put the whole big picture together, you realize there's a lot of commonalities that are in there that people aren't seeing, like sleep, like loneliness. That's probably the biggest risk factor for all diseases and mortality is loneliness and isolation, right? You see other risk factors as people feeling, especially during the pandemic, as if they're isolated and they're forced into sort of this isolation. And then that creates, relationship issues and stuff like that. Like, this is the real root of issues with all across medicine. But these are the data points that we should be tracking. But it's not really until the last 5 years or so the government's really wanting to track this, called SDOH, social determinants of health, right? But that's where we're going in the very near future. I'm super excited about it because I do think that the way that medical policy is kind of going towards that, so we can practice our style of medicine, whether it's lifestyle medicine, functional medicine, et cetera, et cetera.
Can you give me a description of lifestyle medicine?
Yeah, so lifestyle medicine to me means that we have to look at the way that we're living, okay? Lifestyle medicine is looking at not just our lifestyles, how it pertains to disease, but like as a human, as a whole population, right? Because if we just look at one human and what his or her lifestyle is about, we're missing the much bigger picture. Because part of lifestyle is connection. And part of connection is the way that we kind of interact with each other, right? So in our facility, we do a lot of group interactions, group visits. We do it virtually, online, and we do it in person. And so because we do all that, we're seeing how people live their lives, but we can see it through other people's lenses as well, and we come together and talk about it. I mean, this is what the community's for, is coming to talk about it. So I've always found it silly that you can go to any city in the United States and go to church or temple or synagogue, but you can't go to a doctor's office and talk about your health as a group and feel safe. That's the thing, right? The sense of safety and certainty has to be there within the medical profession. And I think it's time for medical professionals to open up their space to have meetings, if you will, right? And talk about health, not for doctors to educate patients only, but doctors to learn from the patients. And in every meeting, I tell the patients that I am here to learn from you. I don't know what your life is like. But if I do know, and another patient comes by, I can tell the patient, hey, you know what? You're not alone. There's other people that are just like you. And let's meet on Thursday, right? Because you're going to meet a lot of them. And that's how we've been able to develop our reputation in the community.
How are you getting patients interested in getting to a community or a group? Because we're so used to getting behind that closed door, having that private space. How are you getting them involved in a group?
This is actually a really easy question to answer, and although a lot of doctors have asked me this, I have a nonprofit, the Physician Transformation Institute, where we educate physicians on communications and strategies. And so I like to start off with the patients with two questions, right? Number one, like, what is the best 10 out of 10 outcome you want to achieve for your health today, right? Mm-hmm. And then number two is, what's my role in your health? And patients usually take a big pause, like, no one's really asked me that before. Mm-hmm. But what I did is I put the control like in the patient's hands, and I'm the guide. I'm not the patient's hero. The patients are their own heroes. You're your own heroes. Everyone's we're our own heroes. We can't be anyone else's heroes. And what happens then, it creates this mindset, oh, I'm here for me. I'm not here for just a prescription or anything like that. I'm here for me. And I think when we open up conversations like that, it's really easy to ground someone's mentality in the sort of the safe space, because we speak like we're coaches. right? And I think that is a process called motivational interviewing, and there's other different names for it, that I train my team on. So once a month, we shut down the whole practice with full day training, usually the last Friday of every month. So that's what we do. We look at case scenarios. We're looking at how we can eliminate conflict within each other, and what type of patients are looking for a communication style. We even program the artificial intelligence to let us know that. The AI is able to look at what the patients are saying and how they're saying it, and say, hey, you know what, there are these words you might want to avoid for this particular person because this person has either PTSD or something like that. Or it'll say that, hey, this person's an engineer, you want to have very clearly listed outlines for them.
That's wonderful, and I'm sure we'll talk more about AI in the future.
Yep.
So thank you so much for coming today. I know we have a couple of other segments and topics we're going to talk about.
Yeah.
Could you please let our audience know how they can reach you and what you're working on right now?
Yeah, absolutely. So the website for my clinical practice is texascenterforlifestylemedicine.org. I'm pretty active on Instagram, so follow me on Instagram. Just search my name, Cheng Ruan, MD. For those healthcare professionals, I do have a huge education and service for healthcare professionals to teach them the way that we actually run our practice and business. So find me on LinkedIn. Once again, Cheng Ruan, MD.
That's wonderful. Well, thank you so much again for joining us. And we are going to wrap up our episode of The New Health, but come back and see us next week when Dr. Ruan will be joining us again.
This has been a Now Media Networks feature presentation. All rights reserved.